Good morning, everybody. Our lab today is about the topics of the stomach, liver, and spleen. And with the stomach is the esophagus. First, we will look to this sample of the stomach. The stomach has an orifice above, which is called cardiac orifice, that is connected here with the esophagus, and also has an orifice here which is pyloric orifice, that is connected with the duodenum, first part of duodenum. So it has two orifices. In addition to having two orifices, the stomach has anterior surface and behind this a posterior surface. So it has two orifices and two surfaces. In addition to these two, the stomach has two borders. An upper border, which is called lesser curvature, and a lower border, which is below, that is called the greater curvature. So two orifices, two borders, two surfaces, two borders, two orifices. This upper border, which is called lesser curvature, as you can see, shows a dependent region, which is this one. You can see this is a curve that descends and then goes up. It descends and then goes up. So the most dependent part of the lesser curvature, where I'm pointing, this dependent point is called the angular notch, because it is the angle located in the lesser curvature, right? And also between the esophageal opening here, the cardiac opening, also called esophageal opening, and the greater curvature, this is the greater curvature. All of this is the greater curvature. So between the greater curvature and the cardiac orifice, which is the esophagus, is another angle here. You can see this angle. It's called cardiac angle. So we have two angles, cardiac angles between the greater curvature and the esophageal opening, and angular cardiac angle and cardiac notch and angular notch, which is in the dependent part of the lesser curvature. Sometimes the angular notch is called incisora angularis, and that is the cardiac notch. So two openings, two surfaces, two borders, two angles. The stomach generally is divided into two parts also. What are these parts? I will begin at the angular notch, which is this one in the lesser curvature, that is called incisora angularis, and I will draw with the forceps an oblique line from the angular notch directed downward and to the left. So by this line, I'm dividing the stomach into a part above the forceps, above this line. This part is called cardiac part of the stomach, because it is near the cardiac orifice. And the part of the stomach below the forceps, below the oblique line, is called pyloric part. So the stomach is divided by the oblique line running downward and to the left from the angular notch into a proximal or upper cardiac part and a lower pyloric part. Each of these two parts, the cardiac part and the pyloric part, is divided into two. Let us start. What are the two parts of the cardiac part? I need to draw a horizontal line, just like that. I'm drawing this line with the forceps. From the cardiac notch, you know, this is the cardiac notch between the cardiac orifice and the greater curvature. So from the cardiac notch, I will draw a horizontal line. That line was an oblique line from the angular notch, downward and to the left. But this line is not oblique, it is horizontal line. This horizontal line from the cardiac notch will divide the cardiac part into a part above this line, which is this one, called fundus of the stomach, while the part below this line, which is this one, is called body of the stomach. Therefore, returning back to the oblique line, the cardiac part of the stomach is divided into two parts. Pyloric fundic part, this is above the horizontal line drawn at the cardiac notch, and all this is body of the stomach. The body and the fundus are two parts of the pyloric part. Returning back to the pyloric part of the stomach, this part is also divided into two parts. Distally you have this cylinder, it is a cylindrical part called pyloric canal, and before it the dilated part is called pyloric antrum. So the pyloric part below the forceps, which is below the oblique line, is divided into two parts: pyloric antrum, the dilated part, and pyloric canal, which is cylindrical part. So each of the two parts is divided into two. Right? This is all about the stomach from outside. You know, the stomach is intraperitoneal organ. And you have to know that the term intraperitoneum does not mean that the organ is in the peritoneal cavity. The peritoneal cavity does not contain any organ. The peritoneal cavity, which is between the visceral and parietal peritoneum, contains only a fluid, which is in a thin film of a fluid called peritoneal fluid. So when we say the stomach or any other organ is intraperitoneal, it means just like my hand. My hand is surrounded by the glove. So my hand is inside the glove. It is intra-glove. Right? Supposing that the glove is peritoneum, which is a membrane. So my hand is inside the glove. It is inside the peritoneum. Okay? It does not mean that the forceps, if I'm holding the forceps just like that, the forceps is intraperitoneal. No? The forceps is now in the peritoneal cavity. Right? If the gloves are peritoneal. But my hand is intraperitoneal. And therefore, the stomach is intraperitoneal organ, because it is surrounded from anterior, posterior, all of the sides by peritoneum, just like my hand, which is inside the glove. And this intraperitoneal stomach is suspended below by a fold of peritoneum, which is this one, that is the greater omentum. You can imagine that the peritoneum covering the anterior surface and the peritoneum covering the posterior surface of the stomach extends below the greater curvature. This is the greater curvature, as a fold which is called greater omentum. Right? And also the lesser curvature is suspended by a peritoneal fold that extends from the peritoneum on the stomach above to the liver, which is the lesser omentum. Right? Both of them contain many structures. For example, the lesser omentum at the lesser curvature contain the right and left gastric vessels and nerves. Okay? We will know later on the origin of the gastric vessels. But now we must know the origin of the gastric nerves. The gastric nerves are the vagal nerves. Vagal nerves in the thorax surround the esophagus as an esophageal plexus. And when the thorax enters into the diaphragm, the vagal nerve will remain on the sides of the esophagus, which are right vagus and left vagus nerve. But then, when the esophagus connected with the cardiac orifice of the stomach, the vagal nerves now are called gastric nerves, in which the left vagal nerve will be anterior gastric and the right will be the posterior gastric. So if I'm looking to the lesser curvature, to the lesser omentum at the lesser curvature, and I will see a vessels inside it, you have to come so close to see these vessels. I don't know if you can see it or not. This vessel is a gastric vessel, maybe a left or right. And if you will find a structure that seems to be a nerve, this is a gastric nerve. Supposingly here, I can see two structures closely, a vessel and a nerve, which is this one. This is the nerve and this is the vessel. You have to look at it so closely on the sample. The video will not demonstrate that. So these are the gastric vessels and gastric nerve. In addition, the greater omentum at the greater curvature, this one, also shows vessels, but it does not show nerves. So we will see here, this is one of the vessels. You have to look at it so closely. This is the gastroepiploid vessel, right? So this is the description to the stomach from outside, the anatomy of the stomach from outside. Now I will open this stomach and I will see the inside of the stomach. Just go to the cursor on the computer, the white cursor, because I will not be able with pointing with the forceps. So I will open the stomach. This is the inside of the stomach. You can see that the inside of the stomach shows many folds. These folds of the mucosa are called rugae of the stomach. They are not a constant fold. When the stomach will be empty, it will appear just like this. But if the stomach is full, the folds will disappear. The mucosa will appear smooth. So they are transient or impermanent folds, except folds at the lesser curvature. Folds at the lesser curvature, which are these, are longitudinal, as you can see. They are called gastric canal. These mucosal folds on the inside of the lesser curvature, which are called gastric canal, are permanent folds. They will not disappear when the stomach is full. And via these canals, the mucosal longitudinal folds at the lesser curvature, the fluid will pass rapidly from the esophagus to the duodenum. And that's why in some regions, especially the cold regions, where they are drinking too much hot coffee and tea because of cold weather, this gastric canal, the longitudinal permanent fold at the lesser curvature, will show burns and ulcerations because of too much fluid of coffee, hot tea. It will show ulcers here. Okay? Other folds are irregular, as you can see, and they are not permanent. In addition, we said from outside that the stomach has two orifices, cardiac orifice, which is connected with the esophagus, and pyloric orifice, which is connected with the duodenum. The pyloric orifice is guarded by a valve, and we will see this valve. If you open the cardiac orifice, just look to the layers. This is the mucosa. Look to the cursor. Next to the mucosa, this red layer is the muscle of the stomach, the muscular layer. You can see at the cardiac orifice, the muscle here is thickened. This is the sphincter. It is formed by thickening of the muscle layer of the stomach, which is called pyloric sphincter. Could be seen here and also here. You can see how thick it is. This is the muscle layer, and it is thickened there and there to form a sphincter. Because the pyloric sphincter is seen as thickening of the muscle of the stomach, it is seen, and therefore it is called anatomical sphincter. Why we are saying that the thickening of the muscle at the sphincter could be called as anatomical sphincter? Because at the opening of the esophagus with the stomach, there is another sphincter which is called cardiac sphincter. But here you will not be able to see the thickening of the muscle at the cardiac sphincter. But here the muscle will contract by nerve stimulation and the closing the opening of the esophagus with the stomach, which is called cardiac opening. And so this sphincter, which is the cardiac sphincter, is called physiological sphincter. It is not anatomical sphincter, because you could not see here any thickening of the muscle. So it is a physiological sphincter, functioned by contraction of the nerve, by nerve stimulation. Many of us going to the physician, saying to him that I feel a regurgitate of an hot acidic fluid out of my stomach into my mouth, which is called reflux esophagitis. The doctor will tell him that your cardiac sphincter is weak, okay, and you have regurgitation of the gastric content into the esophagus, and that's why you will feel something hot or acidic from your stomach, because this sphincter is a physiological. Any weakness in the muscle contraction will open the sphincter. Supposingly, it will not open if it is normal. These patients also suggest that when they will sleep after a heavy dinner, they will feel that all the content of the stomach comes back to the mouth. This is not normal, right? This is all this sample. I will put it here in water, and you can get it out and examine it well. But this is a plastic sample showing the same everything. Of course, this is the peritoneum is removed. First, I want to say something here, please. I forget to say something. If you look to the sphincter, the anatomical pyloric sphincter, right? So what is this? This is the duodenum. Of course, this is the sphincter, so this is the end of the stomach. This is the anatomical pyloric sphincter. So if you go distal, this is the duodenum, and this is the pyloric canal, right? The sphincter here, the thickening of the muscle, separates the duodenum, first part, from the pyloric canal. So going back to the plastic sample, the plastic sample shows also the same talk which I had just said. This is the cardiac notch, this is the angular notch, this is the fundus and body of the cardiac part of the stomach, What is the antrum and pyloric canal, or the pyloric part of the stomach. In X-ray, I think your lecture told you, the fundus of the stomach, which is above the horizontal line, we say that if we draw a horizontal line from the cardiac notch, the cardiac part of the stomach will be divided into a fundus and body. The fundus of the stomach is filled with air when we are standing. And that's why I think your lecture told you, if you would take an X-ray to the abdomen or lower thorax, and you will see air below the left side of the diaphragm, you will see this is air in the fundus of the stomach. Because usually chest X-ray is taken when the patient is standing. And when you are standing, the fundus of the stomach is filled with air. Going back to the real sample, this is the fundus of the stomach. It is above the horizontal line from the cardiac notch. This fundus is filled with air normally when you are standing. And you can see this air in the fundus in chest X-ray at the lower thorax below the diaphragm on the left side. Gas in the fundus of the stomach is a normal finding. You can see in this plastic sample the peritoneum is removed and the muscles is frankly seen. And you can see that at the greater curvature of the stomach here, you have vessels. This is the gastroepiploic vessel. While here, at the lesser curvature, you have another vessel which is gastric, not gastroepiploic. And with the gastric, you can see nerves. These are the vagal nerves that are now called gastric nerves as anterior and posterior. You can see how the left vagus, of course this is the esophagus, the left vagus form the anterior gastric nerve, while the right vagus form the posterior gastric nerve. Posteriorly, the peritoneum is not removed in the plastic sample. And if I'll open this, I had opened the stomach, you can see the rugae. They are irregular folds which are impermanent, not permanent. But at the lesser curvature, the folds are longitudinal because they are called gastric canal, transmitting the fluid from the esophagus directly to the duodenum, and they are permanent folds. See how the muscles at the pyloric sphincter are thickened. This is the pyloric sphincter. So this is anatomical sphincter. Beyond it is the duodenum. This is the pyloric canal, and this is pyloric antrum. While here, at the opening of the esophagus with the stomach, there is no thickening of the muscle because this is physiological sphincter. Okay? Any questions? بس شوية صوتكم طلاب صوتك معي بابا. Now we will pass to the spleen. This is the spleen. The spleen is a wedge-shaped organ. Wedge-shaped organ. It has a pointed posterior end, which is this one. Just see how it is pointed. And a wide anterior end. I'm pointing to it by the cursor. This is the wide anterior end. So the spleen is a wedge-shaped organ with a pointed posterior end and a wide anterior end. Okay? This spleen has a convex lateral surface which is related to the diaphragm. This is a convex lateral surface. And an irregular visceral surface. So it has a pointed posterior end, wide anterior end, lateral convex diaphragmatic surface and medial irregular visceral surface. The convex diaphragmatic surface is separated from the visceral surface by upper border. This is the upper border. And from the other side, this is the upper border. The convex surface is separated from the visceral surface by upper border, and from that side, this is the lower border. Right? In the visceral surface, which is this one, you can see a border, which is this one, called intermediate border. That is the upper border, that is the intermediate border, and that is the inferior border or lower border. The intermediate border divides the visceral surface into two regions, region near the upper border and region near the lower border. This region between the upper border and the intermediate border is the gastric region of the stomach, of the spleen, sorry. It's here related to the fundus of the stomach. While this region between the intermediate border and the lower border is the renal area of the spleen. So the intermediate border divides the renal area of the visceral surface from the gastric area on the visceral surface. Of course, this is the posterior pointed end, and this is the anterior wide end. Why the anterior end is wide? The anterior end is wide because it is related to the colon, specifically splenic flexure of the colon. Another question. How could I know that this is an upper border and this is a lower border? The intermediate border is so clear, but how could I know that this is upper and this is lower? The upper border saw a notch. You can see this notch and that notch, which is called splenic notch. The lower border does not contain a notch. And the intermediate border shows vessels that are passing into the spleen, which are splenic artery and vein. So what is between the upper border that shows splenic notch and the anterior border that shows the splenic vessels, this is gastric area of the visceral surface. And on the opposite side, this is the renal area between the intermediate border and the lower border. And the anterior end here is related to the splenic flexure of the colon, the wide anterior end. The posterior end have nothing. Of course, in theory, they say that the spleen is related to the odd numbers. 1, 3, 5, 7. I think your lecturer told you about that. Because it is 1 inch in thickness, 3 inch and 5 inch in length, 1 ounce in weight, 2 inch in 3 inch in thickness, 5 inch in length. Right. اوكي، خلينا على السبلين وعلى الستمك. وعلى الاسبوع القادم نحكي لكم الليفر ويا الدودنم، بس هو يعني هم حكي هواي يعني.